and administering insulin. So before you can do that, you have to know your patient's blood glucose levels. So after I check my patient's blood glucose levels, I'm going to check the MAR, and I'm going to just make sure that I have an order for this type of insulin. And so I identified my patient whenever I checked the glucose. They had said the right name, right date of birth. And then I went ahead, their glucose was a little high, so I went ahead and did an assessment. They showed signs of hyperglycemia, so that's hot and dry, sugar high. So their skin was hot, they were very dry, they had blurred vision, and like nauseous, cramps, very flush, that kind of thing. So then if they would have been hypoglycemic, cool and clammy, need some candy. So their skin would have been cool, clammy. They could have had some vision changes, could have had, seizures, which would be way late. That'd be really bad. But so I did my focus assessment. I went ahead and asked them about when the last injection, what their site was, and they said it was on the left abdomen. So I am going to assess the site of the right abdomen because that's where I want to administer my insulin. So went ahead and did all that. I'm going to come in to my little med room right here, and I'm going to mix up 5 units of NPH and 5 units of regular. And that's just according to the sliding scale that the doctor put on the MAR. So I'm going to take my little alcohol pad, and I'm going to clean the tops of my insulins. And then I have my insulin syringe. So uncap this part. This part. So it's going to be clear before cloudy. So I will take this and draw up 5 units of air that I'm going to put into the cloudy. So I will make sure to go in but not touch the solution. Insert my 5 units of air and then pull out. And then come back, since I'm doing 5 units of regular, put in 5 more units of air. Come here, inject to the regular, and then I'm going to go ahead and draw up my 5 units. Okay, as you can see, I have 5 units, and then I'm going to come to my intermediate and draw up 5 more units, and I should get a total of 10. And so I would take this and I would get a second nurse to double check because this is a high alert medication. So I have my insulin. I'm going to go ahead and carefully just recap it and label it for my patient and all of that. So then I'm going to go to my patient's room. I'm going to perform some hand hygiene. I'm going to put on some gloves before I administer. Okay, so then I am going to just take that off. This is my little patient. This is their abdomen. They are very skinny, so I'm probably only going to get 1 inch. So I would insert at a 45-degree angle. So first thing I'm going to do actually is take my little cotton swab, my alcohol pad, and I'm going to circular motion for about 30 seconds, and then I'm going to let it dry. So I'm going to take my insulin, I'm going to pinch the skin up, bevel up, and it's going to be like a dart at about 45-degree angle. So dart it in, and then just kind of slowly insert the insulin, and then I'm going to hold it for a second just to make sure that it all goes in, and then take it out. I'm not going to massage the area or anything. I'm going to carefully put my cap back on. Go ahead and put it into the sharps container, and then take this alcohol swab and put it back on. Make sure that if there's any blood, to get the blood off, that the insulin isn't left on the skin or anything, and that's it. So then I'm going to take off my gloves and throw them away, and then I'm going to document the amount of insulin that was given, the time it was given, the site that it was given, and how the patient handled it. And that is how you mix and administer insulin.